This is Dr. Kaveh Milani for Virginia Medical Updates. In this program, I do want to address some of the issues that I see often, almost daily, in the Fairfax, Northern Virginia, Washington, D.C. area that has to do with sleep. Insomnia and sleep disorders are exceedingly common in this area. So oftentimes people come to the office, say, Dr. Milani, I can't fall asleep at nighttime. I can't really basically achieve restful sleep. I wake up in the morning and I'm tired, I'm not refreshed. And some of the people obviously may have kind of snoring issues, may have be overweight. And oftentimes people may be taking stimulants, for example. So people that are taking Adderall, Ritalin, Concerta, uppers, so to speak, may have that difficulty with this kind of 2 or 3 or 4 in the morning awakening. And then in order to keep sleep at nighttime, they got to take a strong dose of sedative and sleep medication or Benadryl to keep themselves asleep at nighttime. They wake up in the morning more groggy and they have to take more medication. And so that's obviously a big mess. The best thing in the logical and rational interview with the patient is to figure out what is the level of physical activity, what time of day are they physically active in, what are they doing in terms of stress management, are they taking any medications that could potentially cause issues, what's their level of caffeine intake, what's their waist to hip ratio, what is the potential for snoring and for difficulties with breathing. By a careful examination of the back of the throat, the tonsils, the oropharynx, and also to look at the level of physical activity. Oftentimes, students sleep in an unusual way. People have exams, they stay up late, or people are watching a TV series like Lord of the Rings or movies, or watching Game of Thrones on Netflix or on TV, and basically at some point they are going to bed at 1:30, at 2 in the morning, and clearly people that binge watch series like that are always having problems. Like in a couple of weeks from now, House of Cards is going to come out. I know people are going to be binge watching that on Netflix and other things too. So in general, I do recommend that people have a kind of an organized bedtime. Definitely no screen time, no TV, no iPhone, no iPad, etc. for about an hour before bedtime. Definitely an organized physical activity level helps. I do encourage people not to drink any caffeine or very intense black tea before they go to bed for a few hours. If people have difficulty falling asleep, warm milk has been studied and has shown some benefit in terms of allowing people to fall asleep easier. And then definitely, again, avoidance of screen time is very important. Keeping a very organized schedule in terms of bedtime is very beneficial. And if need be, sometimes there is need to use medications for sleep. There are a number of medications that are very beneficial, and this would be between the patient and the physician, depending on every kind of variation, individuals, and also the level of tolerance potentially. But I would definitely look at medication that have low side effect load in terms of being able to put people to sleep easy, kind of comfortable, without any excessive side effects or morning somnolence or drowsiness. The most effective, I believe, system for managing sleep would be about 7 to 10 days of medication at nighttime to organize sleep in a better way. Once the sleep is better organized, then people can potentially go off the medication, because it's like a computer system that is basically locked up. You may kind of unplug it or reboot it, and basically things go back to normal again. When sleep gets kind of a little disorganized, sometimes like 7 or 10 days of medication should help restore basically a new habit and a new structure. But especially for people that are taking Adderall, Ritalin, uppers, stimulants, oftentimes it's very difficult to actually achieve good sleep. So it's key to organize the medications. People are doing phentermine for weight loss. Likewise, they have difficulty with waking up at nighttime. And one of the key issues is to actually take the medications away for some time to allow for sleep to be put into place again. And once sleep is restored, then people can really emerge kind of normally, functionally, happy, and go on with their lives in a very productive and useful, meaningful way. So again, in general, increased physical activity for sleep is essential. An evaluation of the head and neck for any sleep apnea evidence, abdominal girth, obesity is an issue. Asking the bed partner about potential snoring or apnea episodes are very important. And then otherwise, basically, I think the taking away of all the offending agents and potentially having people be on some form of medication maybe for some time to reboot basically and restore their sleep back to normal, and then a quick taper off the medication is really the most sane and proper way of managing this issue. Again, this is Dr. Kavya Milani checking out for Virginia Medical Updates, and I look forward to seeing you at a future episode. Thank you.
Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today's program is brought to you by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. The areas of focus are in weight management, preventative medicine, and holistic health. Today we have with us Dr. Mahsa Ostavarnia. Thank you for being here with us today.
My pleasure.
Dr. Mahsa is a functional medicine practitioner and a chiropractor at Virginia Family Medicine. She earned her bachelor in biology from George Mason University and went on to complete her doctorate degree in chiropractic care from Life West in Northern California. Her studies led her to mentoring with one of the pioneers in functional medicine, Dr. Kalish, in the Kalish method, which solves many health challenges through specific lab testing, addressing the three key areas of hormones, GI, and detoxification. More recently, Dr. Mahsa proudly served as an active member in Functional Medicine University, International Association of Chiropractors, California's Chiropractic Association, and the League of Chiropractic Women. Also in 2015, she was selected as one of the top worldwide leaders in healthcare in the Silicon Valley. It's an honor to have you with us here today.
Thanks for having me.
And today we're going to be discussing migraine headaches. So tell us exactly how would we know if our headache is actually a migraine?
Yes, migraine headache. Many of us get headache.
Right.
Unfortunately, migraine headache is a big problem, and it costs millions and billions of dollars in our healthcare system and affect about more than 30 million people in our country.
Okay. If it is an actual migraine.
It is an actual migraine, yes. And the characteristics that you can find out if your headache is a migraine headache or just other types, or it's just very severe. So you cannot just wait, the headache goes away and go back to work. Mm-hmm. You have to do something about it. The other characteristic of your headache, migraine headache, is the type of headache you get. Basically, it's not just achy pain. You feel like a throbbing pain, and the location of your pain is different. It's not like all over your head. It starts from one side. It's a type of unilateral pain. Usually patients get it behind one eye or one side of their head.
Okay.
So that's another characteristic of migraine headache. Last but not least, it gets worse with activity. So patients with migraine headache, again, they need to rest. They need to close the door in a dark room, no sound. So these are the main characteristics.
Okay.
While patient with migraine headache, which may last 4 to 72 hours,
wow,
they get super sensitive to natural light, to normal sounds, and they might get nausea and vomiting in some cases.
So this might be why we see so many patients heading to the hospitals and increasing the costs of healthcare there.
As a matter of fact, that's one of the most common causes that patients end up to emergency room.
Okay, so tell us, are there different types of migraine headaches?
Yes, there are. When you feel like the pain is coming, the aura is showing up, that's a classical type.
Okay.
And there is a common type, and so many subtypes. Vestibular, basilar, ocular, go on and on and on. We are not going to get into that. What matters is what is the underlying cause of your headache.
Okay, right, exactly. So it's something that you would have to hopefully follow up with your doctor and see what may be causing it. But what would you recommend, something that we could do that could help get rid of these migraine headaches?
Yes, that's the time that functional medicine comes in place.
Okay.
So functional medicine is medicine by cause. It's not medicine by symptom. So we have to find out what is causing, what is triggering the symptoms in order to find and fix the problem.
Right, okay.
There are many factors that can contribute to migraine headaches.
So some detective work has to be done.
Exactly.
Okay.
And guess what? After all, your migraine headache might not all be on your head. There are 10 patients, for example, if they all have same symptoms with headache, migraine headache, they might have a different cause. And so we have to figure out what is triggering their symptoms, and then by finding the root cause, we can address their problem and help them out.
Okay. So what would be a way that we could find out what exactly is causing?
There are so
migraines?
many factors that contributing to triggering their problem. They might be low in vitamin B deficient, so they might be low in vitamin B. And they might be having some hormonal imbalances.
Okay.
Their melatonin, one of the hormones that helps you to wake up and sleep, has a cycle of your sleep pattern basically. It might be low or high, so it's imbalance in melatonin. Sometimes you have food triggers, you have allergy to some foods. You can have gluten sensitivity. There is a protein in wheat, rye, and barley, oat. You might be allergic to it. So there are different factors. Sometimes you have problem in your first and second bone of your neck, so the nerves that going to your neck is not functioning properly.
Okay, so of course, as you mentioned, finding out what is actually causing these migraine headaches to occur. You mentioned the foods. How could somebody find out if a food or an allergy would be causing these migraine headaches?
That's a good question. There are so many tests out there that you can check your food sensitivity, but the best and convenient one is doing elimination diet. Elimination diet, basically, you just remove a specific type of food like dairy, nut, or egg.
So just one at a time?
One at a time.
Okay.
And then wait for a while. If your symptoms went away, so that's a sign. It might be that food. Wait, and if you're feeling good, just add that specific food to your diet again. If you get worse and you feel bad again, just it's that type of food.
And how long would you recommend for your patients to wait to go without that specific type of food?
It takes about 3 weeks normally. Depends on the age, weight, and the type of food.
Okay.
General 3 weeks.
3 weeks to go without it, and then if that doesn't cause any migraines, move on to the next group that you might try.
Exactly.
Okay, I see. So what about any other types of levels of, maybe you mentioned vitamin B12, any other types of elements that could be causing these migraines?
Actually, it's vitamin B2, riboflavin.
Okay.
It's one of the vitamins that you definitely need to check with your family
B2.
physician.
Okay.
They can check, find out if you're low in it. Or magnesium.
Okay.
It's one of the other minerals that it's very crucial to have it in balance and in check. It's very easy by blood test or just find out what is.
So would your level of magnesium be elevated or low?
It's low.
Okay, and that would be causing the migraine headaches as well. Is this something that could be, if it is low, medication or supplement that somebody would take?
Yes, when you feel like you have cramping, muscle cramping, or fibromyalgia, some type of symptoms like that, you're definitely low in magnesium. But definitely there are good supplements. Just consult with your practitioners. They can recommend the best quality supplements tests to make sure that you are in a normal functional level.
Okay, okay. And then as a chiropractor, are there any types of procedures that can be done to help with migraine headaches?
Yes, there are so many techniques that can help to align the first and second bone. Let me show you what I am talking about
great.
here.
Great.
All right.
Handy dandy spine here.
Here you go. That's our spine. This is the first bone, atlas, that's holding your skull, your head, and this is the second bone. In most cases, your skull holding your brain, and your brainstem is here. So in most cases, when these two bones are misaligned, so the fluid, the blood, nerve, all these components that passing through this area are not functioning because of the inflammation that's happening due to rotation of one of these bones. If you have car accident, if you had a long dental surgery, or you
Just
had
kind
a
of wear and
sport
tear,
injury,
maybe? Okay.
exactly, can damage these areas. And as a result, many patients get migraine headache. There are specialized chiropractors, and they called upper cervical chiropractor, and so they can manage and align those two bones and make sure they're functioning properly, non-invasively. Even kids get that treatment done, we adjust, and it's pretty safe, and they can get back to normal without having recurrent of migraine headaches.
Okay, and how soon would they see any results from having that alignment?
Mostly the next day or two.
Oh, wow, okay. And is there a decrease altogether of the migraine headaches, or they would just maybe see
The frequency,
they would be gone, or?
sometimes yes, sometimes the frequency drops by 80%.
Wow.
All depends on the case and chronicity of the condition. Absolutely.
Okay, okay. And any types of, you mentioned, again, going back to the foods, it would be something that we would have to see individually. There's not a specific food that you could say, you know, I don't know, something with more salt that could be causing migraine headaches, or a specific type that we should avoid.
There is always, we take a long history before we recommend anything to patients and run specific exams to make sure every individual is different. So we have to, as a detective, we have to dig in, find out the root cause, and it's an individual-based medicine.
Okay.
So functional medicine, we have to just focus on every individual based on their history and their symptoms.
Right, okay, and so hopefully that would help decrease sending everyone to or patients going directly to the hospital, either getting these alignments or you know, checking their levels to see if that magnesium level isn't too low. Would you recommend having a daily supplement?
Yes,
magnesium?
there are daily supplements that patients should take, vitamin B2, magnesium, but it's all based on patient's age, weight, and other medications that they are taking. So everything should be safe and in a normal range.
Okay, so of course, as you mentioned, with functional medicine, you have to have it individualized for your own treatment. So
exactly.
Thank you again for discussing this important topic, Dr. Massa.
Thanks for having me.
Of course, it was great to have you with us. And thank you again for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and we hope to see you next time.
Hello, this is Dr. Kavian Melani for this episode of Virginia Medical Updates. One of the major issues that I have to deal with in my medical practice on a day-to-day basis is to give patients recommendations for physical activity and for exercise. Some of the patients really do well. They're athletic, they run marathons, they participate in races, they're in good form, they bike. A number of people are really excellent athletes, and that's probably about 10 to 15% of our patients in Fairfax in the Northern Virginia area. They have lean muscle mass, they have a very good low body fat, they have cardiovascular fitness, they have a fit BMI, low body fat. But a lot of other patients that come to the office really are stressed out. They are physicians, they are lawyers, they're dentists, they are construction workers, or carpet installers from different fields. And they do not have the know-how, the time, or the interest for exercise, in a sense that it is not part of their day-to-day planning. It is not part of their day-to-day management of their activities, and it's an issue that they know that they should do something about, but they're not really actively engaged in trying to figure out what to do with that. So for these patients, the best thing to do is to figure out, what are you interested in? And what are your goals in exercise? Do you want to go back to your high school kind of shape, high school body? Do you want to eradicate diabetes? Do you want to manage your cholesterol? Do you want to get rid of your abdominal girth? Do you want to basically look more lean? Or do you want to have basically more cardiovascular fitness? So the first issue is to figure out, what do the patients want? And the second issue, which is very important, is to figure out, what actually is it that the patient is interested in doing? Someone, for example, may be really interested in hot yoga, but someone may really deplore hot yoga. So I can't prescribe yoga in heat for everyone, but some people may really enjoy running outside. Some people may really enjoy running on a treadmill. Some people may really enjoy playing a game of basketball twice a week. So basically, whatever people choose to do, or whatever I prescribe for people, first of all, it needs to be something that is actually fun and enjoyable. There's no point in giving people an exercise plan that involves an activity that they do not enjoy. The other limitation is cost. Some people can have gym membership, pay for it, month after month, $120 a month for years on end, and never go to the gym. Well, I disapprove of that, because I don't want people to waste their money either. If people have a gym membership, I want them to be able to go to the gym and enjoy it. However, if people don't want to go to the gym, that's perfectly fine. For the basic level of fitness, I think 3 or 4 times a week of half an hour of fast walking is a great place to begin. It's not very intense on the time. It is doable in the Fairfax, Northern Virginia area most of the times around the year, and it is cheap. It is not cost prohibitive. You just have to buy a pair of sneakers, running shoes, walking shoes, and then you could do that. So that's the first thing. The second thing is, what is it that actually people want to achieve? If people want to basically go to the form that they had in high school 20 years ago, then basically the level of activity has to be increased. It is may require more organized activity, maybe a coach for some time, maybe a personal trainer for some time, to get to that level of fitness and exercise. But in general, for most of my patients, I see, what are they interested in doing? If they like to play basketball twice a week, that's fantastic. If they like to play soccer, indoors, outdoors, that's amazing. Running is a cheap, affordable, fun exercise. Biking has a lot of followers. There are good trails in Northern Virginia that people can use. And people can also, at the least, do fast-paced walking, which is really beneficial and has all kinds of cardiac benefits and is very useful. So having said all this, I definitely want to encourage everyone to figure out physical activity for themselves. It turns out that it has benefits on cholesterol management, body obesity, decreasing abdominal girth, which can lead to diabetes, hypertension, and a lot of other bad things. And it actually does improve mental functioning, decrease anxiety, and has an antidepressant effect. So if all these benefits, some level of activity is essential for everyone, but it has to be tailor-made for everyone. And again, it has to be something that people like to do, is enjoyable, not too expensive, and does not basically impose on the rest of what in generally is a very busy lifestyle. So my final recommendation is, anything you want to do is great as long as it's organized and you do it on a regular basis. And definitely I do not recommend spending a lot of money for this, whereas most of the fitness can be achieved with a few dumbbells in the house at a cheap price, or walking or running or biking. Again, this is Dr. Kavyan Milani for Virginia Medical Updates, and I look forward to seeing you at our next episode. Thank you.